distancing is difficult, and that they continue strict requirements for long-term care facilities where, as we know, Maine has seen several outbreaks. My administration will issue an emergency rule for nursing facilities today and issue guidance on cloth face coverings in the coming days. Stage 1 also allows for the limited expansion of certain businesses, certain religious and quality of life activities with appropriate safety precautions. These include health care from Maine licensed providers with recommendations that they prioritize care for patients with time-sensitive conditions, and that they assure the safety of patients and staff and communities, that they manage the use of essential resources like PPE and testing supplies, and that they pace the reopening of services to the level of community COVID-19 activity, that they maintain capacity in our hospitals for any potential outbreaks. Stage 1 also allows certain personal services, barbershops, hair salons, and pet grooming according to specific protocols. They may open. It allows limited drive-in and stay-in-your-vehicle religious services to be conducted. Drive-in movie theaters, outdoor recreation, for instance, guided outdoor activities, hunting and fishing, and the restricted use of golf and disc golf courses. State parks, state-owned public land trails, and historic sites may open, although certain coastal state parks will remain closed. Auto dealerships and car washes. Automated car washes, right? That's stage 1. Stage 2, tentatively beginning June 1, Stage 2 contemplates revising the limitation on gatherings from less than 10 to less than 50 people. It also calls for people who can work from home to continue to do so, but allows for employees in certain fields to begin to re-enter the office as needed, including state employees. Stage 2 maintains the recommended 14-day quarantine for people entering or re-entering Maine, and special precautions for older Mainers and people who are at risk because of underlying medical conditions. With appropriate safety precautions, Stage 2 will allow for some degree of opening by reservation only, with capacity limits and other measures for restaurants, for fitness and exercise centers, nail technicians, retail stores for broader in-store shopping, lodging and campgrounds for Maine residents, day camps for Maine children, and the coastal state parks that are closed now. That's Stage 2. Stage 3, tentatively, beginning July 1. Stage 3 contemplates maintaining the prohibition on gatherings of more than 50 people and other Stage 1 and Stage 2 restrictions, like the 14-day quarantine on people coming into Maine. And with appropriate safety precautions, Stage 3 would allow for some degree of opening for lodgings, such as hotels, Airbnb, campgrounds, summer camps, RV parks, for Maine residents and visitors. We are developing guidelines now to assist those entities in safely reopening, and reservations should not be accepted until those guidelines are issued. It'll also allow for outdoor recreation such as charter boats and boat excursions. It'll allow for bars to be open July 1, and personal services such as spas, tattoo and piercing parlors, massage facilities, etc., among other things. That's Stage 3. Stage 4, now there's no time frame for Stage 4 at this point. However, this last stage contemplates, if all goes well, lifting restrictions and allowing all businesses and activities to resume with appropriate safety precautions. Now, my administration is also working with stakeholders to develop plans for a safe return to school in the fall for all grades. And I expect to have guidance available by mid-June to share with you all on that issue. The stages outlined above are a framework for planning. Innovations or expanded testing and other capacity might accelerate the pace, as could a determination that certain parts of Maine, such as some rural areas, might be able to ease restrictions safely sooner. At the same time, a surge in COVID-19 in parts or all of Maine could result in significant adjustments to the plan and a return to more restrictions. Please understand when I say we're not flipping a switch today from closed to open. We are adjusting the dials, easing some restrictions while adding others. The month of May will look very similar to the month of April, except that you may, with added precautions, take your pet to the groomer, get a haircut, buy a car, worship in your car during a drive-in religious service, receive medical care that you may have put off, and participate in outdoor activities in a way that protects your health and the health and safety of everyone around you. And every one of us will continue to protect our health by taking the same preventative measures that have helped to avoid catching a cold. Washing your hands often for 20 seconds each time. Cover coughs and sneezes. No shaking hands. Staying home if you're sick. The author Veronica Roth once said, quote, "There are so many ways to be brave in this world. Sometimes bravery involves laying down your life for something bigger than yourself or for someone else. Sometimes it involves giving up everything you've ever known or everyone you've ever loved for the sake of something greater. And sometimes it doesn't. Sometimes it's nothing more than gritting your teeth and getting through the pain and work of every day, the slow walk toward a better life. That's the sort of bravery," she said, "I must have now. That's the sort of bravery and patience we all must have now." These plans are just that. They're plans. We don't know what will happen in the next days, weeks, or months. We may well have to start and stop and start again, or change in a heartbeat to meet whatever challenge greets us with each new day. No one's ever done this before. There's no pandemic playbook, no COVID-19 manual. Things will be confusing because this is complicated. That's okay. We will be flexible, we will be resilient, and we will get through this by doing our part to protect the places that mean so much to us, the people who make those places so special, and the state we call home, within the new normal that requires us to do things in new and unusual and careful and compassionate ways. Thank you, and Dr. Shaw, Commissioner Johnson, Commissioner Lambrou, and I would be happy to take some questions.